Hi, I'm Joan Price, back answering your questions. Let's talk about ED. Let's talk about erectile dysfunction. Many of you sent in questions about erectile dysfunction, but the first thing we need to do is to really understand what is ED versus unreliable erections, because some of the things you were describing in your questions were not true ED, they were unreliable erections. Here's the difference. True ED means that there is no erection no matter what. Not when feeling aroused, not first thing in the morning, not through masturbation, not with sex toys, not at all. No ED. The other thing, which is could be called erectile dissatisfaction. That's a term I learned from sex educator Michael Castleman, or what I call just unreliable erections. They come and go. They're not reliable. You can't always maintain them for a penetrative sex if that's what you want to do. You just can't depend on them. Well, the undependable or unreliable erections, that's a normal part of aging. As a penis ages, it is not as hard, not as reliable, not as easy to maintain an erection. There is usually less semen. All of this is normal. All of this is not a problem. However, true ED is a medical condition. Now, if you or your penis owning partner has true ED, you may know what the reason is. It might be because of, say, a medical condition or cancer treatment, perhaps, prostate surgery. There may be a number of reasons that you know about. If, however, erections suddenly don't happen anymore and you don't know the reason, there is no obvious cause, you need to take that to a doctor, because true ED can be a sign of heart disease, of diabetes, of a neurological condition, of nerve damage. There are all sorts of reasons that are medical reasons that need medical treatment and that need a diagnosis first. Please don't just run to, oh, okay, we know about these performance pills, we'll pop a Viagra. No, don't just pop anything. Please have your condition diagnosed and use performance pills only if your doctor says it's okay, given your condition, because if they are contraindicated in some cases and can result in death. Okay, I'm going to scare you now. So don't just go for, hey, my friend has these, I'm going to try them. Mm-mm. And also only use the performance pills even after your MD says it's okay, if that's what your partner wants. Ask your partner, do you care whether I have a hard erection for our sex play today? Do you care? Because often a partner will say, not really. What I'd really rather do is be pleasured by all these other ways that it's easy that you can give and receive pleasure that don't require an erection. Sometimes making the erection the star performer means that if the erection doesn't show up or leaves the stage early, that you feel like it's performance anxiety. It's doomed if the erection doesn't show up and stay shown up. So instead of that, let's just take the goals off the table. I'm going to pleasure you. You're going to pleasure me. Yes, a penis owner can have great arousal and pleasure and orgasm without an erection. You might not know that, but it is absolutely true. Now, it's also handy to know about sex toys that don't require an erection, such as the Hot Octopus Pulse, the Fun Factory Manta or Volta, the Arcwave Ion. These are great ways to give a penis-owning partner or yourself wonderful pleasure and orgasm, and no erection has to show up. If the erection comes and goes and you want to do what you can to keep the erection longer, to maintain that erection, often a cock ring is helpful. Once you are erect, slide that cock ring on and it will help you hold an erection for a period of time. Even if there's no erection, you can give and receive pleasure and orgasms. Please know that. Till next time.